Hello everyone, this is Dr. J and welcome back to the channel. I want to start off by saying I am sorry. I do not upload very frequently, and that is going to be the case as I do have a full-time job as an ear, nose, and throat surgeon, and summertime where I'm at is a very, very active time frame. And we had many activities going on. My practice is in full swing and it's growing and it gets very, very busy. So I apologize in advance and for just not being able to put videos up very frequently. And so I appreciate your patience with me, number one. Number two, I appreciate all the new subscribers that are coming on board. We're approaching 50,000, which is kind of mind-boggling to me, considering where this channel started. This actually started as just a platform to be able to show a few patients some of the surgical options that I can provide, and you can see those at the my very first few videos. It's like a tonsillectomy, a nasal polyp surgery. Granted, the nasal polyp ones were kind of a shock and awe, large polyp removals, and a Clarifix procedure, which is for chronic runny nose and such. But I bought a new microscope, and then I uploaded, and it's one that can video record and take pictures. And so I uploaded a unique ear cleaning, and all of a sudden it was at 250,000 views, and I was like, whoa, people are really liking this. And people started subscribing. I said, well, maybe there's something to this. And so I started uploading more earwax cleaning videos, and the views went up, the subscribers went up, and then all of a sudden it was monetized, but it's not a real monetization. It's like a token monetization. I don't make well, let's put it this way. It's not worth my time uploading earwax videos. But I've been on YouTube for many years on another channel, and it's just a hobby for me. So I appreciate your patience with me, and we'll continue to produce these videos, and I'll try to do it as frequently as I can. So we're just cleaning up the ears on this patient. Their wax consistency was very sticky. This is the second case, a very young person. You can tell that it's a young person by looking at the quality of the skin. You can see it's a very young skin. It's not our classic, some of the patients I've had in the past on here, they have very hairy ears, which we see that as we age. But this is a very young person, and I believe this one was young enough that we were questioning whether or not they would be able to sit still enough for this procedure. Younger patients just don't have the self-control that an older patient would have or an adult would have. But they were able to tolerate this very well. We got the big wax plug out there that looked kind of like a chocolate Easter bunny there. And I'm fast forwarding here. I'm just playing with this skin ribbon. As you know, when the wax gets impacted, the skin doesn't migrate out normally, and it kind of piles up. And so there we go. We were able to get that skin ribbon out, and the eardrum was normal on that side. So here's another sticky wax obstruction, and we're looking at the right ear, and just inside the ear you can see that it's not a hard impaction. You can tell just by looking at it that it's got a very soft consistency. Usually these come up fairly quickly in the larger suction. This is a number 7 Fraser suction. It's the largest one I typically use in the ear canal. And you see there that there was a skin ribbon there, but sometimes you can just tuck those aside and line them up so that once you get them on proper drop regimens, it should migrate out normally. I had a question recently from one of the subscribers about how do you prevent wax accumulation and obstructing the ear canal. And it's, in general, we can make a few recommendations, but it's going to be very different for individuals. Things that can make it worse, obviously Q-tipping can make it worse. Some people can Q-tip their whole lives and never have a problem with wax impaction or ear infections of the canal, or sometimes it creates pain. And some people can do the Q-tipping their whole life, and for them that's great. I don't have any problems with that. We just let people know what the potential problems may be. And so when people do come in with those problems, we would advise them to not Q-tip. Other problems that can create cerumen impaction would be hearing aids or frequent AirPods or earbud use, or hearing protection for those who work around heavy machinery or shoot a lot of recreational firearms. Those can tend to pack into the ear canal, wax from the outside to deep. And then the other situations are just anatomy, like their ear canal opening is just very narrow, or they have a very hairy and narrow ear canal opening. Those can tend to cause some obstructions. So other than the anatomical differences, the best way to not let wax accumulate in the ear is just don't put things in the ear. Let the ear take care of itself. And then on top of that, you can use topical drops. Most of the time, oils work very well. And what I recommend is 1 to 2 times per month for the average person. If they put oil in their ear right before bed, this can be virgin olive oil, mineral oil, Johnson & Johnson baby oil, coconut oil, avocado oil. All of those oils can work safely in the ear canal. There's no magical one drop that's best for everybody. So most of those are already in the home. They're over the counter. You don't need a prescription. And so 1 to 2 times per month, right before bed, put the drops in the ear canal, followed by a cotton ball. And then you put the drops on the other side, followed by a cotton ball, and you go to bed. You wake up the next morning, you pull the cotton balls out, and you go about your day. And if you do that 1 to 2 times per month, that's usually enough for that oil to sit in there. It will lighten up the consistency of the wax that's produced in the ear, and it will help keep the skin in the ear canal that's trying to migrate out thin enough and loose enough that it will migrate out normally. And sometimes we increase that to once every week. If it's a real bad impaction, we'll have them hit it daily and then bring them back in so that we can do a debridement on them. So that's in general what I recommend. Now, in scenarios where, or cases where there is an infection, such as fungal or otomycosis, then we have to put the appropriate drops in. If it's fungal, then we use an antifungal drop. Or if it's bacterial, we'll use a bacterial drop. And most of the time, that is antibiotic, antifungal mixed with a steroid. And you clear the infection, and sometimes that requires frequent debridements, and you're bringing them in once a week or so to just clear the ear canal out to try and help debulk the situation, which helps a lot. So this is the last case here, and it's very deep, it's very obstructed, and a big plug came out, and then you were expecting to see a normal ear canal afterwards, but no, it was very impacted all the way into the anterior sulcus, resting on the tympanic membrane. And we're trying to work it out here, but it's starting to break up in small pieces, and it's coming up in the suction, which is nice, but obviously we want to bring it out in one piece and just be done with it. As we go back in, there's a few more bits and pieces of it here and there, and you can see we're working all the way down into the anterior sulcus right next to the eardrum. And as we work towards that anterior sulcus, we'll lift up just a little bit more. And then this patient gets those same instructions. They get the oil drops, and then I'll see them back. Usually in this scenario, And when they have just a little bit of residual here and there, I'll see them back in about 4 to 6 weeks to make sure everything's migrating out normally, and it usually is already migrated out. But thanks again for your patience. I will continue to upload videos. Thank you for subscribing. Thank you for your comments, all you wonderful people out there. I appreciate you, and thank you for watching. Have a great day, and we'll see you on the next video.